Hello everyone, welcome to Dr. Spine. So let's continue our pulmonary section with compliance part 2. As you can see on the screen, we have discussed that compliance is the ability of the lung or in the thorax to expand. And the term specific compliance gives an idea of stiffness of the lung. So specific compliance is compliance of the lung divided by functional residual capacity. And the types of compliance is static compliance and dynamic compliance. What is static compliance? Static compliance is we measure the elasticity or the compliance of the lung in the absence of any gaseous exchange or any air. While in dynamic compliance, we measure the compliance or elasticity of the lung while the gaseous exchange or air is going in and out of the lung and the thorax. So let's start with static compliance. In static compliance, we have taken an isolated lung. In isolated lung, it is not within with chest wall. It is isolated where there is no gaseous exchange taking place and the transpulmonary pressure is also zero. So in such situation, when a lung it is at deflated position, it is not distended. When we increase the pressure, a little change in the volume will cause the lung to inflate immediately. As there is no transpulmonary pressure, the lung volume would get easily up to its volume would get easily changed. It would get larger. Similarly, when we take an isolated chest wall, in isolated chest wall, scenario is little different. What is that? That when the isolated chest wall is taken, it is normally larger than at rest. The isolated chest wall has larger volume at rest, and as it is attached to structure of the chest wall like ribs, and because of that they oppose too much inflation or distension of the chest wall. And also we know when there is no transmural pressure acting on the chest, then also its size would be 60% of TLC. Means when the chest wall is not inflated, then also it would have such larger volume in that position. So in that situation, when we increase the pressure in it, the volume would be sudden rise. This is the volume that would rise in that situation. Why is that? Because it is already 60% of total lung capacity. After that, further increase in pressure would just change the volume a little bit, but that would be sudden. And while deflating the chest wall, we cannot deflate it further less than the residual volume. We can deflate the chest cavity up to residual volume only. As the chest wall is attached to the structure like ribs, we cannot get the volume of the chest wall smaller than the residual volume of the lung. Now when we put lung in chest wall, see a situation that the chest wall, which is stiff, which cannot inflate further more inflate up to more than normal physiological limit, and nor it can deflate more than physiological limit, and it is attached to the lungs. Lungs as a being an elastic tissue would love to get smaller, would love to go back to its original position, would love to recoil. Lungs recoil inward, and chest wall, as it is connected to the ribs and all other structure, it recoil outward. So in such situation, when during inspiration the lungs would expand, and along with that up to physiological limit the chest cavity also would expand, and after that during expiration the chest cavity would recoil to back its original position, and also lung would recoil back. But as it is connected to the chest cavity, the lung would not get further deflated. It would get only deflated up to a normal physiological limit. Further deflation is prevented due to presence of chest wall and due to negative transpulmonary pressure. That's the reason we get a different graph as I shown in the red line. But as we know that it can deflate it only up to the residual volume, as it is the physiologic limit of deflation. Further deflation or getting smaller volume is not achievable, as we put lung inside the chest wall. Both of them compensate each other's position and maintaining the normal physiological value. Now let's continue with dynamic compliance. So dynamic compliance takes place when the gaseous exchange is taking place, means air is going in and out of the lung. During dynamic compliance, during breathing, the energy required to overcome goes through three types of resistance, which is airway resistance, elastic resistance of lung and thorax, and non-elastic viscous resistance. What happens is that when the alveoli is deflated, there is sticky material present in it, and because of that, during inspiration, when the air rushes inside of the lung, it has to overcome those sticky material and inflate the alveoli, and in that place takes place slowly and gradually. So inspiration is slow and then it achieves its full volume total lung capacity, while in expiration it has already achieved its full volume, and during expiration it comes to different paths than inspiration, as it has different volume and different pressure acting on it, but it gets smaller up to residual volume only. How can we differentiate that? So let's consider, I've drawn this line, here. This is point A. At this certain pressure, the volume of the lung is this much. Similarly, at same pressure, during expiration, the volume of lung is much higher. So here we can get an idea that there are difference between pressures acting on the lung during inspiration and during expiration. At this pressure, the lung would having volume A, but at same pressure, the lung would be at volume B during expiration. So this is the difference between dynamic compliance and static compliance. Continue with how the lung functions, means compliance, how it affects the function of the lung. So I have drawn a little diagram. As you can see, let's consider there is an elastic rubber. There is a round elastic rubber. Just see here. It is attached to the elastic strands. On one side it is hooked with this round structure, and other side it is attached to the chest wall. These are those elastic strands, and this is the chest wall or cavity which is attached to. Never mind. So when air passes in, so when air passes here, this cavity expands. As you can see here, this cavity would obviously expand when air comes in. When this cavity expands, this structure would also expand with it, as they are elastic strands, as they are hooked one side on here and one side on here, this round structure. And when it does that, this round structure also would get expanded and air would rush through in, and thus during inspiration, this round structure which is elastic would get larger. As we know that this round structure is also elastic structure, which would love to get smaller. Any elastic structure, of course, it won't like to get stretched. It would love to retain its original normal position. But because of the presence of these hooks, this elastic tissue, this round structure are holding in their position. It prevents it to get further smaller. So what happens in any pathologic condition like fibrosis? In fibrosis, there are normal elastic tissue. Along with that, there are fibrous tissue, and which affects the compliance of the lung. As we know that if we add more and more elastic tissue and more fibrous tissue to any area, it would be less compliant. It would be like a thick material. So in that the compliance of the lung is decreased. So it won't be able to further inflate as it would be inflating earlier. Like with rising here, there would be a rise here, but there won't be a significant stretching, and because of that this won't get any further larger. While in emphysema, what happens is that the elastic strands here are reduced, and why it is reduced I will explain it below. So these elastic strands are reduced, so the elastic capacity of those strands to stretch this round structure are reduced, and because of that, in during inspiration, of course, as it is a large elastic tissue, it would stretch this round tissue significantly. But during expiration, what will happen? This round elastic tissue would love to get smaller, means it from its original this size, it would love to get to this size. So when it wants to get smaller, this elastic tissue, elastic strands are not sufficient enough to hold this round structure in its position. And what will happen? That when a person inspire, he will inspire normally, but during expiration, this round structure would get immediately smaller, and the cavity would be filled with air, means the alveoli would be filled with air would be trapped in it, and that happens in emphysema. As we can see in the when we draw a graph of the compliance, in fibrosis the compliance is reduced than normal, and in emphysema the compliance has increased because of decreased elastic tissue. As elastic tissue is reduced, it can be easily stretched. So what are the reasons of increase in compliance? Old age is physiological, emphysema pathological. And decrease in compliance causes are deformity of thorax, which is kyphosis or scoliosis, or it can be fibrotic pleurisy, paralysis of respiratory muscles, pleural effusion, or abnormal thorax, which include pneumothorax, hydrothorax, hemothorax, and pyothorax. So emphysema, as we have discussed earlier, that it increase in compliance. So how is emphysema caused? It may be caused due to smoking or air pollution or chemical fumes coming out of dust. So here in graph you can see that a person is smoking, and of course in the smoking, the smoke would contains irritants for lungs, and in lungs there are alveolar macrophages. These are angry alveolar macrophages who are ready and would love to eat any irritant particles. So when an irritant particle comes, these alveolar macrophages get active and try to engulf those particles, as you can see. And during those engulfing particles, those macrophages make certain lysosomal enzymes which would digest away those irritant particles, and these enzymes would have collagenase and elastase, which would digest away collagen and elastase. So what would happen when a macrophage would try to engulf these particles? The enzymes from the macrophage would drip out and fall into the lungs, meaning into the alveoli. So what would it cause? So when on an alveoli, such enzymes like collagenase and elastase fall from the macrophage, those area would get destroyed. Those specific elastic tissue is destroyed, and because of that destruction of elastic tissue, as you can see, the macrophage is eating. Along with that, the enzymes are dripping out of macrophage and is affecting the alveoli. And what would that collagen elastase will affect the alveoli? That it destroys the elastic tissue and collagen, resulting in reducing in those structure, causing is to digest away the alveolar septum. The alveolar septum would be digested. So as we can see further, when the lung was full, healthy, there was more surface area for the air to come into contact with the lungs and blood vessels. So after digesting away of those elastic tissue, the area of the lung where gaseous exchange can take place is reduced, and that occurs in emphysema. Also, we have discussed before that in emphysema the patient has less amount of elastic tissue, and because of that the elastic tissue is less, so this structure would love to get smaller, and because of that during inspiration air would come, but during expiration the structure would get easily smaller and the air is get trapped. So the person who is smoking, he would be seen a barrel shaped chest. That's all for today, guys. Thank you. Don't forget to subscribe, like, and hit the bell icon.